Caution is advised when giving morphine with phenobarbital due to the increased risk of CNS and respiratory depression and profound sedation effects. Morphine levels may also be decreased when given with phenobarbital. Morphine should not be given with onfi due to the increased risk of vasodilation, hypotension, CNS and respiratory depression, and psychomotor impairment. Common side effects of morphine include bradycardia, respiratory depression, and constipation. Morphine is a pregnancy Category C medication, and caution is advised in lactation. There is a risk for abuse when taking morphine.
It is contraindicated in hypersensitivity, hypercapnia, upper airway obstruction, acute or severe asthma, severe liver or renal insufficiency, GI obstruction, increased ICP, and circulatory shock.
Caution is advised in patients with renal or hepatic impairment, CNS depression, head injury, seizure disorder, substance abuse, alcoholism, delirium, toxic psychosis, kyphoscoliosis, adrenal insufficiency, hypothyroidism, urethral stricture, acute abdomen, biliary disease, acute pancreatitis, debilitation, elderly patients, neonates and infants less than 3 months, and patients with decreased respiratory rate.
Methadone produces analgesia and sedation. It is used in the treatment of narcotic addiction, and in KL's case, it is used to treat difficult-to-treat pain. Methadone has an onset of action of 30 to 60 minutes, a duration of 6 to 8 hours, which increases to 22 to 48 hours with subsequent uses. Its half-life is 8 to 59 hours, and the average hours in children is 19.
Pharmacokinetics. Methadone has varied bioavailability with oral administration between 36 to 100%. It is 85 to 90% protein bound. It is metabolized in the liver by CYP450, 2B6, 2C9, and 3A4 isoenzymes. It is eliminated in the urine and feces. Drug levels should be monitored when methadone is given with phenobarbital due to the potential for decreased levels. Phenobarbital may also precipitate opioid withdrawal, increase the risk of CNS depression, and psychomotor impairment. Caution is advised when giving methadone with baclofen, clonazepam, and lorazepam. Caution is advised when giving methadone with clobazam due to the increased risk of vasodilation, hypotension, CNS and respiratory depression, and psychomotor impairment. Side effects of methadone include bradycardia, hypotension, CNS depression, seizures, urinary retention, constipation, and respiratory depression. Methadone is a pregnancy Category C. It is probably safe for use in lactation, but caution is advised. There are no set guidelines for renal or hepatic dosing. Methadone is contraindicated in hypersensitivity reactions, dialysis, hypercapnia, upper airway obstruction, acute or severe asthma, severe liver or renal insufficiency, known or suspected ileus, and severe respiratory depression. Caution is advised in patients with renal or hepatic impairment, CNS depression, decreased respiratory rate, QT prolongation, cardiac conduction defects, cardiac hypertrophy, concurrent diuretic use, hypokalemia, hypomagnesemia, obesity, sleep apnea, volume depletion, COPD, asthma, acute abdomen, head injury, increased ICP, elderly or debilitated patients, patients with thyroid disorder, prostatic hypertrophy, urethral stricture, and pregnancy. Baclofen is an antispasmodic and muscle relaxant used to decrease pain associated with spasticity in patients with CP. Its exact mechanism of action is unknown.
Onset of action following oral administration is 3 to 4 days, with maximal clinical effect in 5 to 10 days. A peak effect is seen in 2 to 3 days, and the half-life of baclofen is 2.5 to 5.5 hours.
Pharmacokinetics. The absorption of baclofen is dose-dependent. There is rapid GI absorption. 30% is protein-bound. It is metabolized in the liver and eliminated primarily in the urine and feces. Caution is advised when giving baclofen with methadone and morphine due to increased risk of CNS depression and psychomotor impairment. Baclofen should not be used with clonazepam, lorazepam, or phenobarbital due to the increased risk of CNS depression and psychomotor impairment. Use of baclofen with clobazam may also increase the risk of CNS depression. Side effects of baclofen include hypotension, chest pain, palpitations, dyspnea, weight gain, drowsiness, fatigue, dizziness, slurred speech, insomnia, hypotonia, ataxia, weakness, confusion, rash, nasal congestion, nausea, vomiting, constipation, abdominal pain, hematuria, decreased urinary frequency, and nocturia.
Baclofen is a pregnancy Category C medication, and it is possibly unsafe in lactation. Baclofen is contraindicated in hypersensitivity, dialysis, hypercapnia, upper airway obstruction, acute or severe asthma, severe liver or renal insufficiency, known or suspected ileus, severe respiratory depression, caution with renal or hepatic impairment, and seizure disorders.
Calcium carbonate. Calcium carbonate is a calcium supplement that affects nerves and muscles. It is also an antacid, which has the capacity to neutralize acid.
Calcium carbonate has an unknown half-life, and there is a variable onset of action. Calcium carbonate has a bioavailability of 25 to 35%. 45% of it is protein-bound. Its metabolism is unknown, and it is eliminated in the urine and the feces. Interactions include bran, foods high in oxalates and phytic acids. There is a decreased absorption of calcium if you take calcium carbonate with these foods. You want to minimize your administration of this medication with dairy products, and KL has no current interactions on his medication list. Common side effects for calcium carbonate include hypotension, mental confusion, rash, nausea, vomiting, constipation, and renal failure. Calcium carbonate is a pregnancy Category C medication. It is probably safe in lactation and is contraindicated in ventricular fibrillation, hypersensitivity to calcium formulation, renal calculi, hypercalcemia, and some forms are contraindicated with PKU. Calcium carbonate has no set renal dose adjustments, but we do recommend periodic use if using for long-term treatment or with chronic renal failure. May cause electrolyte abnormalities, and 9 to 18-year-olds need 1.3 grams per day of elemental calcium, NTE 3 grams per day.